What if I told you that understanding this will improve the results with your patients? Well, that's what I want to discuss in this video as I share why I believe that everyone should really be looking at, comprehending, and assessing the infrasternal angle. So before we can actually discuss the benefits of the infrasternal angle, we first need to know what it actually is. So let's define it really quickly so then as we continue on with the benefits, we understand it a little bit better. So two key terms I want you to take away is the pump handle and the bucket handle. So the pump handle is the sternum and the bucket handle is the lower rib cage. The ISA is defined as the angle that the bucket handle or the lower rib cage creates with the xiphoid process. So we're going to have varying degrees, some more narrow, some more wide, as you see with the blue. And that's going to really help us understand these key benefits that we're going to talk about. The ISA really helps us identify overall movement patterns. And I find that instead of going straight into the different movement patterns, it's easier to comprehend from a therapist perspective, but also to educate your patients in a way that is something that's more familiar to them. So I like to use cars as an easy analogy. And what I want you to think about is a Lamborghini and a smart car. And when I said those two terms, you subconsciously created expectations, right? And so you can think about that the Lamborghini is fast, it's terrible on gas, it's really fun to drive, it's expensive, right? And the smart car is more practical, not as expensive, better on gas, right? And so what really drives those expectations? Those expectations are driven by the structure. And that's what I really want you to take away from this is that the structure, aka the ISA, is telling us what we are going to start to expect to see. Just like we would see those expectations with each one of those cars, we're going to see certain expectations or certain movement patterns based off the structure of the person in front of you. And so we can start to classify them as either wide or narrow. So what that means is a wide would be represented from this blue tape. As you'll see is this blue tape is more at a horizontal, right? It's not really at this more narrow kind of 90-degree angle. And so this is going to produce different movement expectations compared to this, right? And so as we keep going forward, we'll continue to discuss that. But what I want you to really think about is understanding we have a wide or a narrow. Wides are going to produce certain movement patterns, such as internal rotation, adduction, and extension, as well as more of a flared rib cage and an anterior pelvic tilt, right? So we will start to expect to see those movement patterns with a wide infrasternal angle. Why? Because they're just following their structure. Just like the Lamborghini is going to be fast, a wide ISA is going to be good at producing power. That's what essentially internal rotation is. On the other hand, our narrow ISAs, they're usually good at flexion, abduction, external rotation. They typically have more of a posterior pelvic tilt, a little bit more rounded over. And again, we would expect to see that just like with our smart car, we would expect it to be better on gas and more practical. And so there's two big takeaways that I want you to understand, and that is that the structure is really going to depict the movement expectation, but also that one is not necessarily good or bad, right? There's pros and cons when you look at the Lamborghini and the smart car. It's more so understanding that they're there. And so when you go to prescribe exercise, breathing drills, anything like that, you can be more intentional, right? If you were going to get a car, you would be intentional on what you wanted to get. And the expectations and the features of the car would ultimately drive your decision making. And so as we continue going on and looking at the wide and narrow ISA, we'll start to see that we want to start to do certain exercises for one and certain exercises for the other to have a different outcome or a different output. Next, we can really think about the ISA as to helping us identify postural asymmetries. So what I did here is I put the blue tape On the right side, more at that kind of 90-degree angle, and this left side being flared out. So I want you to imagine that you can't see this and really the rib cage is out. Now, ask yourself, what do you do in this scenario? If you're looking at someone's infrasternal angle, if you see this, what does that tell you? Well, a lot of us forget that if we turn this around, the rib cage is attached to the spine. And so when we are seeing an asymmetrical ISA, that person is indirectly telling you that they are turning, or they potentially are side bending, or usually it's a combination of side bending and rotating. So there's some sort of asymmetry going on, and really being aware of that is the first key to then starting to address it. Meaning, when we are prescribing exercise or breathing drills, we might want to start to bias certain things to start to bring this back down, right? And so if we just think about symmetrical exercises, maybe that's not the best choice for this type of person. Again, it depends on the goal. But if you were looking to get someone out of pain and they are showing you this type of ISA, we need to be doing unilateral exercises. We need to get more compression on this side and more expansion on this side, right? This side's already compressed, so we want to choose exercises in an intentional way that is going to start to compress that, right? And we're going to continue talking about that. But for the postural asymmetry piece, I want you to just be super aware and mindful that the ribs are showing you what's going on at the spine, and the spine is going to continue to have influence as you go down to the hip, and so we'll start to see these different twists and turns. So really start to be mindful of that, so that way when you go into your exercise decision making, you're taking that into consideration. The next piece of information that we'll get from the ISA is an overview of this person's respiration strategies. What I mean is that if someone has a wide ISA, so again, just picture the blue as the end of the rib cage and you can't see anything here. What is that indirectly telling you? How does that come to be? Well, use a water bottle, for example. If this is the front and this is the pump handle, and on the sides we have the bucket handle, how would I get it so we are more expanded out? I would have to compress here. So if I compress there, you now see that we've expanded laterally. That's what's going on from a muscular standpoint for a wide infrasternal angle. There is compression here from muscles. The response is a widening of the bucket handle. Again, it's a simple input to output. We input compression from the pec muscles, from the traps, right? Everything starts to get tight and compresses, and that's going to start to expand laterally. So how do you think that type of individual is going to breathe? Well, when they inhale, they really have no chance to expand here. But the thing is, we really want them to expand here because what's underneath here? The lungs, right? So ideally, we want the lungs to be able to go from an expansion state to a compressed state. Why? Because the body doesn't like when things are stagnant, right? The body likes movement and it likes to pump. And if you can keep your patients pumping, things tend to work in your favor, right? So back to our wide ISA. If we have so much compression here, we can't get that. This is where we see a lot of the belly breathing, right? So we're going to see mostly here. The thing is, they still need to try to lift here. So what do you think will do it? We can't really efficiently do it. There's way too much compression. And so these are the individuals that the accessory muscles, right? The SCMs, the neck muscles, will have to work overtime to start to try and externally rotate or lift the rib cage to get any sort of inhalation or expansion type movements up here at the pump handle, right? So when it comes to understanding their respiration strategy, that's then going to help you understand how do we need to then get them to breathe. So these individuals are going to breathe better with more of a pursed lip type of breath. Pursed lips is essentially closed, and there's a reason behind it. And if you think about a hose with water running through it, if you put your thumb over the hose, what happens? Same amount of water, but increase intensity or increase frequency of the water that comes out, right? Because you decrease the diameter. And so someone that needs to overcome this much compression to get air out to start to close down is going to need more of that pursed lip type breathing. So you see how breathing becomes very intentional and is not this random thing, right? On the other hand, if we have our ISA that's more narrow, so disregard the blue. If we are a narrow ISA, they have a totally different respiration strategy, right? And again, it goes back to the cars. They're just different structures. So again, when you understand that things are different structures, then you understand that it's just an expectation, right? And so when we are more narrow here, we are more compressed at the bucket handle, and we have more ability to expand here. So if there's already an ease to increasing the expansion here, then for those individuals, we want more of like the fogging the glass, right? If you were to fog a glass, you would go with more of an open mouth. That open mouth is as if you removed your thumb off of the hose, water slows down, still same amount of water, just not as fast coming out of the hose, right? And so this is to help them fit within their structure so that we can start to get better breathing, right? We don't need that intensity like we need with our wide ISAs because they're not so compressed here. They're more compressed here, right? So again, the ISA really helps to better understand that person's respiration strategies, meaning how are they managing air, and then how can we improve their management of air when it comes to day-to-day activity, but also performance and moving without pain. So hopefully you're starting to see that when we start to really look at the ISA, it produces purpose. And that purpose is going to carry through to intentional exercise and putting our patients in more intentional positions. So let's start with the positions first. So if we're working with a wide ISA, someone that is represented by the blue tape, what do you think is the best position to put them in? If you had two options and it was hook lying or on their side, which one do you think would be better? Well, remember, now that we're looking at the ISA, we know that they're already too compressed here. We know that they're already too expanded here. So we need them to compress here and expand here. So what's going to do that? We'll go back to our water bottle analogy. If we squeeze both sides, it's going to produce expansion here. That's just an expectation because of the structure. So for a wide ISA, a side-lying position would be way more beneficial because we are having a different input on the structure to get more of this compression. So the output is going to bias more expansion here. So again, now bring that to your exercise selection. Don't get caught up with the exercise, get caught up with the principle. So if we're going to do an exercise or a breathing drill for a wide ISA, a side-lying position for that exercise is going to go way further than a standing or a hook-lying exercise. Why? Because we are working on improving their movement variability by changing their structure, and then we're driving new movements through the new structure, right? AKA increasing movement variability. And that's really the name of the game when it comes to getting patients out of pain. So now let's go to our narrow ISA. Again, disregard the blue tape for our narrow ISA. How do we want to position them? Same question, hook lying or side lying? Well, hopefully you're starting to see the principles at play here. We already said that they are expanded at the pump handle and compressed at the bucket handle. So which position compresses the bucket handle? Well, we just said side lying, right? So instead, a hook lying position would be great. Why? Because when they're on their back with their knees bent, it's going to naturally help this bucket handle to splay more out or expand more laterally. And again, then bring that to your exercise. So a narrow ISA would do better in a hook lying based exercise because we are taking into account their structure, right? So again, the big picture here is really looking and respecting this infrasternal angle leads to intentional exercise, intentional purpose, and really just having more purpose behind what you're doing in the clinic. And I guarantee when you have more purpose in the clinic, that is going to help you get better and better results with your patients. So if you want to dive deeper in really understanding wide and narrow infrasternal angles and getting to a point where you feel confident prescribing or coaching exercise in an intentional way, then I would really encourage you to check out our Performance Redefined course, where we go into much more depth and examples and case studies and the biomechanics behind each archetype. And so if you enjoyed the content within this video, I know you would really enjoy the course. And again, I'll leave that in the link below for you to check out, and I would love to see you inside the course.